Data is probably the most valuable thing in health and healthcare today. We need it not only for taking care of patients, but also in forms of analytics. There are multiple uses of data. We do it for clinical research. We do it to understand the business of healthcare. We need data to do the analytics on what works, what doesn't work. Almost every aspect of business as well as clinical as well as health requires us to have accurate data for healthcare. So there are a number of reasons of which it's difficult to collect good, high-quality data, and we need to increase the automation of data collection to be able to create a higher quality of data. The other part of that is we really need to have algorithms in place that help us correct the data as we collect the data itself. Depends on the nature of the collection, but sometimes if it's being entered into the computer, for example, a decimal point may be omitted, or it may be characters reversed or things of that nature. And so there are a number of techniques that we really need to do to clean the data as it is collected. So HL7 is really working with all the stakeholders, and I think the biggest change from 1987 to today is that HL7 is endorsing and embracing a much broader community of all the different stakeholders, whether it's a payer, whether it's pharmaceutical companies, whether it's healthcare providers, whether it's a vendor, whether it's government, whether it's a regulator. All of those communities now are coming together with a much better understanding of what they want to do, and HL7 has a listening ear of trying to create the standards in an easy to learn, easy to implement way. So we're changing a little bit from the focus on the development of standards to the implementation of standards to the use of standards. And we're bringing all of that community together. So it's a source of standards in healthcare.